Welcome to Module 1 of the 7-module Small Business Resilience Training Program. I'm the director of the Wise Women's Business Center, Megan Florkowski. This is called a training program for a reason. It's no fluff, with the resources you need now to propel your business through the pandemic. You're tuned into the webinar format. This is also available for you in an online format. If you would like access, please email wisecenter@syr.edu. I'm about to be joined by our lead trainer in English, Jennifer Liddy. This is also available upon request in Spanish. Thanks again for joining and enjoy.
Hi everyone, welcome to Module 1. We're covering a lot today and I'm going to share my screen so that you can see what I'm talking about. You don't have to just look at me the whole time. And this will take a minute for me to just set up here so that it works well. Just so you guys know, I'm working off of 2 computers so that I can share the information with you and also read my notes so that I make sure that you get everything that you need. Again, you are welcome to drop, if you are here live, you're welcome to drop comments in the chat. I just want to set this up so that, here we go, this is what I'm looking for. There you go. So I'm keeping my face up here so that you have a person to look at as well as these slides to look at. Megan gave us a wonderful introduction about these 7 modules that you're going to be learning about. And the goals and the purpose of these modules is to help you prepare for and respond to all of the economic impacts you're probably feeling when it comes to the COVID-19 pandemic, how it's affecting not only your business, not only you, but also your employees, your workspace, your customers. There's a lot going on for you right now, and we really want to acknowledge that. So today we are talking about Module 1, and we're going to cover quite a bit of information. What advice I want to give you is, please be kind to yourself as you're going through this module. Don't let yourself get overwhelmed. Take notes. Everything that I'm talking about today, you are going to get in a PDF version. The great thing about that means you can click all of the links I'm talking about. Additionally, what I want you to know is the information shared here is from primary resources. And some of the struggle of what people are dealing with in the response to COVID-19 is, what's the right information? What's the latest information? I heard this from my hairdresser. I heard this from my business partner. There's a lot of information spinning around out there. The information that we are sharing with you comes from 3 primary resources today, and I will go over them as well. Before we get started, I want you to understand we are here to share with you the what, the information, and the why this information is going to be important to you. You might get caught up or worried about or overwhelmed by the how, and that's so normal. And what we want you to understand is that we're giving you this information, and WISE also has business counselors available to you to take you through the how. So if you need somebody to stand next to you and explain things to you or help you in a deeper way, that's when you take the information that we've given you and go talk to one of our counselors. We've just hired some amazing counselors that are free of charge to you, and you can do that by connecting with WISE. So let's get started with Module 1. Module 1 is all about protecting your employees and your workplace during the spread of this communicable disease. What I want you to understand is this whole training does not focus on any one particular industry. Industry-specific guidelines are best found from your particular professional association or your national industry guidelines. So let's keep moving. I love this slide because it's very important for us to take a moment and breathe and remember that we might feel like we're spinning out of control. Our businesses might feel like they're spinning out of control. We don't know what's going to come next. And though we can't always control what happens, we can control how we react to it. And this quotation from Katja Libin is a really great one to keep in mind. Maybe take a screenshot of this, make it part of your, the background on your phone. But remember, you can't control what happens, but you can always control how you react to it. Start this week by investing in your mental strength. And so I'd love to remind you that you do have mental strength, and the fact that you're here means you are ready to move forward and do the best things available to you and your business. So this is a lot. These are the 9 things that we're going to cover in this module, and we're going to break it down into bite-sized pieces for you. So we're going to start with understanding how the virus is spread, and then 2, what controls we can put in place to monitor and prevent the spread of COVID-19. 3, we're going to talk about how to plan, prepare, and respond to all that's going on with the spread of COVID-19. And 4 is to talk about when your business is eligible to reopen, what do you do? What tools are available to you? Goal number 5, or objective 5, is to review the key components of the New York State Reopening Safety Plan. Then we move into objective 6, which is to review the CDC Resuming Toolkit. These are all the primary resources that are available to you to get deep into what you need to do next. 7 is to become familiar with labor laws. 8 is to review and manage workplace fatigue. And number 9 is how to help your employees cope with stress during COVID-19. So you can see we're covering a lot in this module. Again, if you're watching this on a replay, there's a pause button for a reason. And there's a lot of resources here that you can click into and bookmark and play around in and have some notes for yourself. But again, it's most important for you to be kind to yourself as you move through this. So let's talk about this, this information we've gotten. WISE spent a lot of time and effort to talk to the women in our community about what did they need. And so they did these focus groups, and what we learned in the focus groups were very specific needs in the community, and that's what we hope to address in these 7 trainings that you're going to experience over the course of the next few months. The biggest issue was employee absenteeism, which was people who are concerned about their employees who don't want to come back to work because they fear transmission, either getting or giving, right? The second issue was understanding how to protect vulnerable populations. That could be people that you work with or customers who come into your business. And so it's important to educate ourselves on what the guidelines are. The third issue that local women were interested in learning was how to access the proper information. For example, how to disinfect, right? Like I said at the beginning, there's so much information swirling out around there. How do we know what's the real information? Number 4, the women that we talked to, the WISE women we talked to, they wanted to be really mindful of stress and fatigue for themselves and their employees, and then how to handle that. So we're actually going to cover that today. Number 5, the question became, how do I protect myself from customers who don't want to wear masks? What do I do about that? And number 6 was self-policing. How do I get my employees to take a pledge to protect themselves and each other in the workplace? So WISE has done a fantastic job of getting out into the community, actually virtually because we're all at home, but getting out into the community and listening to our constituents. And so these trainings have been a direct response to what you told us you needed. So we're so glad that you're here, and thanks for showing up. Let's talk about that idea of primary resources. So out in the world, there's so much information, and we encourage you to go to the primary resource so that you get this information from the places where it's most recently updated and has the most research backing it. So that's, of course, the CDC, which is the Centers for Disease Control and Prevention. And then, of course, there's a New York State option here for you. There's a New York State resource here for you that's called New York Forward. There's a lot of information in there. I'll actually be talking about that a lot today. And then there's the EEOC, that's the Equal Employment Opportunity Commission. So these are 3 resources. Again, when you get the PDF of this, and I'm not going to take time to do this today, but you could click onto each one of these and go into a myriad of information that will help you really figure out what you need to move forward in your business. So throughout our time together, we're going to talk about Rita. Rita Jones is a woman who has children, and when her children went back to school, she opened a bakery, and she loves what she's doing. And then, of course, boom, COVID-19 hits, and she has to shut down. And so throughout this course, we're going to follow Rita as she navigates how to reopen, when to reopen, what to do with her employees as she reopens. And we're going to learn from her experiences as she gets educated on some specific matters in terms of reopening. So watch for Rita, and we'll be talking about her business and her employees as we move forward. So we're finally ready to jump into objective 1. And our first objective is to truly understand how the virus spreads, because this is foundational. Understanding how the virus spreads is foundational to help you understand the why behind everything else that you're going to learn in these 7 modules. So once you understand this, you're really ready to move forward. Now, this is a short 1-minute video that I encourage you to watch. It actually explains how the virus actually spreads as a respiratory disease. It will help you understand this for yourself, but it will also help you understand this when you're trying to explain it to your customers or your clients or your employees and staff, right? So for anyone who feels confused or uninformed about the spread of COVID-19, this 1-minute video explains a lot. I don't have the time to click on all of the videos I'm going to share with you today, but again, you can access this through the PDF file you will get later. Okay, so objective 2 is to identify the controls that prevent the spread of COVID-19. Your first job is to identify the controls that are needed to be dealt with in your workplace, and that's where we're going to spend a little bit of time in the next few slides. And let's move on to this. So the CDC recommends certain controls for prevention because that's how we're going to contain this. Here on this sheet, on this table, you'll be able to see all the ways, well, some of the ways that can control, and this is subcategorized into 3 main work environments. So for example, the first is engineering. This focuses on facilities and equipment, for example. You will see guidance on the proper operation of ventilation and water systems, for example. So I'm giving you examples here of the types of controls that we can put in place. And again, you'll see at the bottom here, there's a link to the CDC. You want to click on that to go into it and find out the controls that work for your specific business. So I'm talking in generalities here, and I'm giving you some examples, but I'm not really able to go in and speak specifically to your business, obviously, right? Then the second control category is administrative, and that has to do with focusing on management and communication controls, but it also deals with cleaning and disinfecting, plus any training that you will have to do that's relevant to the pandemic. The last and third control category, another way that we can control the spread, is to deal with the PPE or personal protective equipment. And this may include a hazards assessment for your business and determining the PPE for your employees and yourself. For every job, on every duty, we have to provide these to our employees at no cost to them. So there's a lot here, as I said before. To get assistance with any of these, contact your local emergency management office and start with that CDC link right here. Okay, let's move into objective 3, which is like we finally understand the foundations, we understand how it's spread, we understand the areas of controls that we need to personally understand. So what do we do with that information, right? That's what objective 3 is all about. Planning, preparing, and responding so that we can be the most proactive leaders we can for our businesses. So all of these interim guides, and again, you'll see them here, these are constantly updated by the CDC. That's why it's so important to check the website down here at the bottom regularly for updates, because each of these control areas are key to manage and control. We'll review these in greater detail later, but remember, you probably want to make it part of your daily or weekly standard operating procedures at this point to explore more thoroughly what the CDC has to say about prevention and reduction of transmission among employees and customers, how to maintain healthy business operations, and how to maintain a healthy work environment. Let's go deeper into this first one. How do you reduce transmission among employees and your customers? Well, again, like as I've said before, it's important to monitor the local and the federal and the state communications that are coming out about this. So again, don't rely on hearsay, don't rely on texts from your friends, don't rely on emails that are being passed around. Go to the source. And again, those sources are throughout this PDF for you. And then you want to reinforce to your employees how they can protect themselves and others. It's important that they understand, like, we're not just here to protect themselves. If people are coming into our businesses, we also have to protect those people too. An example might be to conduct a daily in-person or virtual health check, which is something we have to do right now. That's looking for symptoms or temperatures, and possibly conducting a hazard assessment of your workplace. And then even deeper, to go further on this, what are you going to do if an employee is sick at work? We'll talk much more about this later. And how do you have an action plan in place for people who in your business who are suspected or have confirmed cases? So again, this is a lot to think about. And I want you to know that your number one concern with this is, how do I prevent and reduce transmission among my employees and customers? That's your responsibility. And there's lots of resources to help you, but make this part of your mental landscape to deal with this. Objective 3.2 is, how do I maintain healthy business operations? So I love this first bullet here because frankly, frankly, imagine if you had somebody who was in charge of this for you. Is there somebody in your business who can serve as a workplace COVID-19 response coordinator? If you are running a business, you may not have the capabilities or the capacity to do all of this yourself. Can you bring somebody on board to help you coordinate this? And then to maintain healthy business operations, you have to think about implementing flexible sick leave and supportive policies and practices. We'll again talk about this more in depth later. You also have to think about how to protect those employees who are at a higher risk for severe illness, those who are compromised. And this is something that is much more easy to think about. How can you communicate the supportive workplace policies clearly, frequently, and via multiple methods? And I'm going to talk about this quite a bit because over communication is actually something that you want to start to do when it comes to the COVID-19 prevention and response. What are your essential functions of the business? Like, what do you need to be worrying about right now? That's something you really want to think about. What can you let go of? What do you need to be worrying about? And what are you going to do if absenteeism spikes? What are the policies you need to put in place for social distancing? And who can be a local manager for you that has authority in your business to help you take care of these issues? So let's move on to the next part of this objective, which is how to maintain a healthy work environment. And again, we're talking about the what's and the whys, and the how is on you. And if you need support, remember, you can always go to the whys counselors for help with that. So there might be things you haven't thought about, like the building water system, or like devices that have been shut down for a long time. You have to ensure the safety of those. And there are specific CDC guidelines for building water systems, which describes steps that you can take before you reopen if you have a brick and mortar. How to supply your employees with, not only your employees, but your customers and visitors, with sanitizer and tissues and soap. Where to put up signs and posters and what those are. Perhaps considering modifying the building ventilation system. And again, there it is again, another guidance document for you to consult. Maintaining a healthy work environment also probably requires limiting travel for yourself, your employees, and how to plan meetings and gatherings that lower the risk of transmission. So again, I will keep saying it, there's a lot of information here, and you don't need to remember all of it, but you do need to know where to access it. And that's what the goal of this training is. So let's go back to Rita. She's done all of that. She has done so much research. She wants to get back to work, but can she reopen her bakery? So let's talk about that. When will your business be eligible to reopen? And I want to share with you a great tool that New York State provided called New York Forward. It's a business reopening tool. It's called the Lookup Wizard. And we're going to talk about that a little bit more here. So How do you know when your business is eligible to reopen? The New York Forward Business Reopening Lookup Wizard is available as a great tool to help you determine, are you ready to open? When is your business ready to open? And what are the public health and safety standards that you have to comply with in order to open? So right down here, you'll see there's a Get Started link. And sometimes you need to refresh it, but this is updated very frequently, and it's a great resource for you that you're going to want to bookmark. So this is what it looks like. Rita clicked on it, and you'll see that it asks for some specific information. What kind of industry is Rita in? Retail bakeries. What county is she in? She happens to be in Onondaga. It's in the region of Central New York. So once she plugged those things in, she learned that her business is permitted to reopen with restrictions. And so now, of course, the next question is, well, what are those restrictions and how do I deal with them? And so we're going to talk about how, once you're ready to reopen and the state gives you the thumbs up, what do you do after that? You need to be fully compliant by creating a business safety plan. So let's move into that. Also, sometimes you will receive this affirmation from the state. Some businesses get this back in the mail, and it's an affirmation of understanding that the form has been mailed and sent and that everything is good to go. So be on the lookout for that if you have done that. So let's move on to what comes after she does the compliance tool. Sorry, this is a little bit repetitive. Let me just move through here. Okay, Rita has assessed that she is ready to reopen. Now what, right? So she's got everything in place. She's done all of her research. She's ready and eager to get her and her staff back to work. But what's next? What does she need to think of? So these next few slides focus on preparing to reopen and what that requires. Okay. That means we can move into objective 5. We're moving through this so much more quickly than I thought we would. This is great. So objective 5 is all about reviewing the key components of the New York State Reopening Safety Plan. And this is what Rita needs to focus on next for her business because she already did all of that other stuff. So understanding the New York State reopening phases. This is kind of a big deal. You've probably heard about this out there. What phase am I in? Well, Governor Cuomo has made it fairly easy to access this information, again, with the New York Forward tool. Remember, that's the primary source that we're using. This is the resource under which we are supposed to follow the guidelines for which phase we're supposed to open in. How do you know that? Well, it's based on when regions will be permitted to reopen. And that has to do with whether a region has met the state's metrics that it's safe to reopen. 2, the next thing to ascertain is which businesses are included in each of the 4 phases. And again, you'll see here we're in phase 3. You can click on that. Step 3 is what is required of businesses to reopen. We're going to talk about that really specifically in a minute, and how compliance will be enforced. Basically, who's watching to make sure that people are doing the right things for their businesses and their employees and their customers. You can see here that there are even some industry-specific guidelines for reopening within this document called backtoworksafely.org. Again, it's right down here for you. This is the American Industrial Hygiene Association. This gives you even more information, another great primary resource. So if you work within one of these industries, go into this document and find out what your industry specifically needs to know before moving on. Okay. So understanding the New York State Department of Health requirements, every business that is reopening needs to have a written safety plan that outlines how the workplace will prevent the spread of COVID-19. And a business can fill out the safety plan template that they give you. And again, there's another link here, which makes it pretty easy for you. Or if you so desire, you can develop your own safety plan. That's totally up to you. You'll find the New York safety template focuses on 3 distinct areas to address in your safety plan. So there's let's first talk about the people, right? There's protections for your employees and your customers. And this includes adjustments to workplace hours and shift design. So we have to think about what's necessary to reduce our workplace density, how to enact social distancing policies, and how to restrict non-essential travel. I touched on that before, but you can see that people is the #1 thing that the state is concerned about in your safety plan. The second thing that the state is concerned about is the kinds of changes that you'll need to make in the physical workspace. And that includes requiring all employees and customers to wear masks or face coverings if they're in frequent close contact with each other. And also we need to understand how to implement effective disinfecting, hygiene, and cleaning, plus communication. Again, I'll talk about that much more deeply in a few minutes. The third aspect of the safety plan that New York State is really interested in is your processes. What are the processes that meet our changing public health obligations? Like, this is constantly changing. So again, we need to constantly be updating ourselves on this. This includes screening individuals when they enter the workplace, and also reporting any confirmed positive cases to customers. We'll talk about that again. But again, look at this. The #1 concern for your safety of reopening is people. Take care of your people, then take care of your place, and take care of your processes. And these don't happen quickly or easily, but you have to, and that's why it's so great to get help for this, but you have to chip away at each of these to make sure you're safe to reopen. The interesting thing about this, I think, is having your safety plan is that you don't need to submit it to a state agency, but you do need to keep it on site at your business in case a local health inspector or a New York State Department of Health inspector comes onto your site. So if you do have an inspection, you want to have this all completed out. So this is kind of a, you might have it in your mind that you could do it, but really write it out just to protect yourself and others. Okay, moving on to Objective 7. Objective 7 is where we're going to review the CDC Business Resuming Toolkit to help your employees reintegrate back into the workplace. This next page has a lot on it, and I'm going to just put it here for a moment. The CDC Interim Guidance for Business and Employers to Plan and Respond to Coronavirus Disease 2019. This is a toolkit. This is a formal, let's just call it the Resuming Business Toolkit, right? But the government has a whole bunch of titles for us. But I want you to understand it's important to consider how much the disease is spreading in your specific community. And this document will help you understand the readiness of your workplace and your management to reopen. So here are some of the tools that can help you. For example, an employer sheet to introduce employers to the contents of the toolkit. And then a restart readiness checklist. You can go in there to make sure that you've checked off all the things that the state wants you to do, actually the CDC wants you to do. The worker protection tool, this is to help employers identify protective measures for your workers when they're interacting with the public. There is a return to work infographic in here to remind your employees, because we all know how easy it is just to go back to old habits. So we're gonna have to constantly remind ourselves and our employees about what to do to keep themselves safe and their customers safe, your customers safe. And then there's a lot of resources in here. So I want you to just take a moment to look at this Resuming Business Toolkit. There's so much information that could potentially overwhelm you, but it's very broken out. And so give yourself time to go through each and say, how do I want to address this? How do I want to print this out? Where do I want to put it? Objective 7 is about becoming familiar with labor laws. And this might be something that makes you feel uncertain. And as small business owners, it's important that we all prepare for disruption in our businesses and also protect our employees and health and safety in the workplace. So in this section, I'm going to talk about the 3 sources that we're pulling from, the 3 primary sources. And I know that this can be potentially overwhelming and that you might be saying, I'm not an expert in law, but that's why these resources are available to you, because we want you to see some scenarios that are happening for Rita that you can start to think of for yourself and have resources to go find the answers for yourself. So moving on, I have to give a little lip service to the Family First Coronavirus Response Act, the FFCRA. Now, this says that certain public employers and private employers with fewer than 500 employees must provide employees with paid sick leave or expanded family and medical leave for COVID-19 specific reasons. And these provisions right now apply from April 1st, 2020 through December 31st, 2020, as of this recording. So again, there's an FAQ sheet for you here, but you need to understand that this is an act that exists and is in motion right now, and that you might not have known that. So let's talk about the other kinds of questions that people have when it comes to labor laws. These are the questions that we were hearing from the people that we talked to who want to start opening their business. What's my regular rate of pay for the FFCRA purposes? Is all leave under the FMLA now paid leave? Like, these are questions that you're going to have. Maybe your accountant is going to have, maybe your business manager is going to have, and you're going to want to provide a resource for all the people who are helping you take care of your business. What does it mean to be unable to work, including telework? That's a great question. We're going to actually see some examples of that a little later on. Who is a covered employer that must provide sick leave and expanded family and medical leave under the FCRA? What is a full-time employee under the Emergency Paid Sick Leave Act? Who is an emergency responder, and what is a place of care? The reason I love that this slide is in place is I want you to know that the questions you're having are very normal. It is very normal to be worried about this. It is very normal to not know the answers to this. But the reason that this training is in place is for you to go find the answers and ask people, because you don't have to walk around in the dark about this stuff. The next thing I want you to see is there's a it's a 42-minute video on YouTube that explains the labor laws in association with the American Disability Act. And so this is something that you may want to spend time really diving into. There's also a full transcript of this. This is a webinar within a webinar, actually, but you can click for the transcript. You can click to watch the 42-minute video, and you can also click on this EEOC document. There's, again, a lot of information here, but it's your job to be updated with the most recent information. So let's go back to Rita. She is semi-open for business, and she's researched. She's done all the work, she's gotten the help, she's asked the questions, and she's implementing the guidelines. So how is she doing? What happens after somebody reopens? Well, she's finding right away that there are some situations that she was not expecting. Let's talk about some of those situations. Her first situation is with Sam and Adam. They often share kitchen tools. In fact, everything in her kitchen is commonly shared, right? Including the bathroom and the back office and the cash register and the coffee pot and the microwave, right? Like, everything is handled by a lot of people. And these were things that we didn't think of in the before times, but now we have to think of them, right? What steps do I have to take as a business owner to clean and disinfect the facility? There is a resource for this, because of course there's a resource for this, because there's a resource for everything. So we want you to review the CDC steps to clean and disinfect the facility. Plus there's an EPA, you can see it right down there, EPA 6 steps for safe and effective disinfectant use. So Rita should also, in addition to knowing those things, communicating them to her employees, posting them so that they can see them. She should also find ways to promote the etiquette for when somebody coughs or sneezes, and for hand washing. So again, it's this over communication and sharing of information to help her get through these really kind of awkward things that we haven't thought about before, but now we have to think about all the time. Here's another situation that Rita was dealing with. There's 2 situations here, actually. The first was she noticed that her employee Rosa wasn't feeling very well. And Rita was like, is this COVID-19 related? How do I know? What do I do? And so what Rita did was she sent her home just to be safe. But what should Rosa do when she gets home? What should Rita do? How does she tell other people about this, right? And there are very, again, specific steps to take in terms of what are COVID-19 symptoms and what to do once you identify those. And then another situation that Rita was dealing with is Rashad and Pat were out sick with COVID-19 illnesses. Are they entitled to paid sick leave? She didn't know about this. So again, the answers are, they are entitled to pay. And you can go to this website here, the COVID paid sick leave page. And there's also a hotline here, which is a really cool thing that you can actually get on a phone with a person to ask these questions too. So there's a lot of information available to you. Now, we also have information about a hotline, which I think is great. Another situation that came up for Rita was, I really, I don't know how to educate and train my staff. I'm not an expert on this. This is not, this is not what I came here to do in my bakery, right? And so Rita could post these COVID-19 fact sheets so that her staff and her customers can see them clearly, and also post the cleaning and disinfecting of community areas information. So there's a lot of questions that come up, and actually Rita has more questions. And I love that there are just answers right here for you. These are really interesting questions, so hang in with me. Peter is an employee for Rita, and he refused to answer questions about whether he has COVID-19. He didn't want to talk about any symptoms. He didn't want to talk about whether he had been tested. And she was like, can he really keep that from me? And the answer is no. He cannot keep it from his employer. He must tell the employer that he either has symptoms, has been diagnosed, or has been tested. Question 2 was about Alex. Alex was out sick with COVID-19 and is now returning to work. Does the ADA allow me to require a doctor's note to certify his fitness for duty? And the answer is no, we are not able to ask for a doctor's note to certify that. And then question 3 was about Kim, who's coming back into the bakery to finally make her delicious chocolate chip cookies. And rumor had it that her husband had COVID-19. Does the ADA allow me to ask her about her husband? And the answer is no. So if you want to go into the reasons why these answers exist, you can again go to the EEOC website or the CDC website. But essentially, you need to know that there are things that you are privy to, and then there are things that you can't ask of your employees. Okay, I'm going to just leave this up here for a moment. These are questions that Rita got from her about her employees. For example, Alex refuses to get his temperature taken or reveal that he has any COVID-19 symptoms. What should I do? And actually the answer is that you, as an employer, are able to bar an employee from coming into work if they will not self-reveal about their situation. Question number 2 was, Alex does indeed have COVID. His test results came back negative. I know I can't reveal his name to other people, but what do I do about contact tracing purposes? Don't the others need to know? And the bottom line is, employers are not able to share the name of the person who is sick. It's really important privacy. Number 3 question that Rita had was, our janitor John is in his late 60s. Maybe I should lay him off because I want to protect him from potentially getting sick. Is this okay? And as you can probably guess, no, she is not allowed to lay off John. That would be illegal. You're not allowed to exclude an employee who's actually over the age of 65. And there are rules about actually age discrimination about anybody over the age of 40. So that's a really important thing that you need to remember. And then number 4, I have a baker who's very pregnant. Should she be furloughed? And the answer is no. Employers may not furlough or lay off any employee based on pregnancy. So these are the kinds of things that you might see in your own business, and you might have like complicated situations and questions, and it's really important that you go and ask those questions and not keep them to yourself and not make assumptions. So as you can see, Rita has had a lot to deal with, and she keeps using these 3 primary resources as much as possible. There's the Empire State Development, the New York State. They have a frequently asked questions center for you. The CDC has a frequently asked questions center, and so does the EEOC. So these primary resources, again, we really highly recommend you bookmark and go back to over and over again. So objective 8, we're almost done. is to review how to manage workplace fatigue during COVID-19, because fatigue is a very real problem. And which of these situations might you see that you could implement in your business? So the thing is, COVID-19 and all of the stress around it creates an incredible amount of fatigue in us. It's very real. And I think it's important that you understand that for yourself. You may find yourself to be fatigued. You may find your employees to be fatigued. And here are 8 ways that you can help combat fatigue for yourself and your employees. The first is creating a culture of safety. This means open communication, discussions about what's really going on, helping them feel safe in the workplace. I think that it's very important that people are encouraged to talk about it, knowing that they're not going to be penalized for being sick or feeling fatigued. Another important thing for you and your leadership team is to understand this, to be able to spot the signs of fatigue. What does it actually look like? Do you have a situation where you might need to recommend nearby offsite housing for your employees? Is that something that could help fatigue? The Epworth Sleepiness Scale is an actual scale that shows you the different levels of sleepiness. And if you become familiar with that, and it's not hard to understand, you can really spot it more easily in yourself and also in your employees and staff. Another option for reducing workplace fatigue is to perhaps provide alternative transportation to and from work, schedule regular breaks for your employees, give them the education and training so that they understand what's happening and why it's happening, and support processes and procedures to help relieve each other as coworkers. So workplace fatigue is, again, a very real thing that you want to start to address as a preemptive, proactive measure. And it can really help your business in the long run, because this is a very real aspect of COVID-19. Now, objective 9, which is our last objective, is to learn how to help your employees cope with stress during COVID-19. So beyond the idea of fatigue, we also have to deal with stress. And what we're going to cover in the next few slides are, what are the symptoms of stress? Do you know what to look for? Know the common work-related factors that actually add stress during a pandemic like this. Know where to go if you need help or an employee needs help. How to share the tips to manage stress with your staff and how to help them build resilience. And then how to be mindful of the stigma surrounding the COVID-19 within your employee and your customer population. So let's go a little bit deeper into those. The symptoms of stress, we're probably familiar with these, but at this time, it's really important to kind of get laser focused and pinpoint them. You might be noticing that people are feeling irritated, angry, or they're actually in denial about what's happening. They might be feeling uncertain, nervous, or anxious, worried, and they are perseverating on that. They might feel a lack of motivation. Somebody on your team who's been highly motivated all of a sudden feels like a real exhaustion, lack of motivation, or they're tired, overwhelmed, or burned out. The feeling sad or depressed is actually a symptom of stress. Having trouble sleeping seems like an ironic thing to say, because if you're so tired, why can't you sleep? But stress keeps us from sleep. And we also it's a hard thing to focus and concentrate when we are feeling stressed. So it's important for you as the leader and the employer to take a look at your employee and your staff and your workers and say, what is actually going on with them? And how can I help? So this objective is all about how to help your employees cope with stress and knowing the common work-related factors that can add to stress. Which ones of these do you relate to the most? Do you have a concern about the risk of being exposed to the virus at work? Or do your employees also have this concern? Do you find that your employees are concerned about how are they going to take care of their personal and family needs while they're also working? Managing a different workload can really add stress to somebody, and that might be something you need to be aware of, like suddenly somebody's asked to do something they've never had to do before. Your employees might feel stress due to a lack of access to the tools and equipment needed to perform their job. They also might be feeling uncertain about the future of the workplace and employment in general. It's a really scary time. Learning new communications tools and dealing with technical difficulties, like how zoomed out are you, right? Like we all have been on Zoom for so long. And for some people, it's really natural. And some of us have never used these kinds of tools, and they can really stress us out if it's not second nature to us or we don't have experience with it. And also it can cause stress to people to try to adapt to a different workspace or a different schedule. So these are all the things that your employees might be struggling with. So it's a great time for you to step back and say, I know I'm stressed. I'm doing the best I can to manage my stress. What do I need to do to help my employees manage their stress? Where might they be stressed? This is a really comprehensive list of the kinds of things your staff might be struggling with. This next slide is full of resources. I'm not going to read them to you, but obviously they're here at the click of, you'll get this PDF and they're available. Just click on and go find some help. Everything from, national hotlines and helplines to local places, local people, local resources to get help to reduce stress. Again, it's your job to help your employees understand, hey, you may be dealing with fatigue. You may be dealing with stress. That's normal. And here are some tips on how to deal with it. This might feel to you like it's second nature, but please don't assume that your employees know these tricks and tools. Please don't assume that your employees understand how to manage their stress. They don't know how to build resilience, but your job is to help them. And so this idea of communicating with coworkers, supervisors, employees, making a safe space where people know that if they do talk about it, they won't be punished or there won't be any backlash for them. 2 is kind of what we started with. What do you have control over? What don't you have control over? Do you know the difference? Bullet point 3 here is to increase your sense of control by developing a consistent routine for yourself. Like do the best you can do to create some consistency in your own days. Bullet number 4 goes back to some of the stuff we talked about earlier. What are the facts about COVID-19? And what are the swirling around, gossip or lies or lore about it? We have to work from facts, not what we believe, right? And then be informed about how to protect yourself and others. We spent a lot of time today talking about that. Understand the risk of sharing accurate information is reduced when we share accurate information. So making sure that people understand, like stop spreading texts about this or stop spreading hearsay and start spreading the actual facts. Then moving on to reminding yourself and helping everyone else remember that we are all in an unusual situation with limited resources and very uncertain future. Encourage your employees, your staff, encourage yourself to take a break from watching or reading or listening to news media, including social media. And also, isolation is really exhausting and stress producing for people, and it creates stories in our minds. So a tip for building our own resilience is to connect with others and talk about how we're struggling, talk about it so that other people can say, oh, I'm with you. I totally get it. I'm feeling the same way. Or I have a strategy that you can use. Or I have this tool that I got from this source. What happens sometimes when we are in a very highly stressful information is we may abuse substances of all different sorts. So if you find that you or somebody that you know and care about is abusing a substance, it's time to reach out for help. And the last one is to recognize that new mental health problems pop up. Even if you are on medication right now, your struggles may be heightened right now, and that's really important to recognize that and be kind to yourself and seek out help with it. So here are some more sources of stress that we need to talk about. This is all about stigma. What is stigma and how do we reduce it? Well, you may not know this, but there have been certain groups who have been blamed and shamed for this pandemic. And so there are specific groups that have been under stress because they have been blamed for this, like people of Asian descent, people returning from travel, Healthcare workers and emergency responders have been blamed because of who they work with. People with the disease and their family and friends, plus people released from quarantine. So these people are receiving sometimes a backlash of others who don't want to be near them, and they are being blamed. So just be aware that this is something that you need to manage as a leader for your business. So what happens to these groups who are stigmatized? Well, they are potentially shunned or excluded in social situations. They are potentially denied job and educational opportunities. They might be denied access to housing and healthcare, and they may be targets of verbal, emotional, or physical abuse. So this is what's happening to these people who are being targeted. And what can you do? Well, education, right? That's what this whole training has been about. Education, get the facts, speak up. We are in a moment where it's really vital for us to speak up if you hear inaccurate statements or see behavior that is harmful, and then to reach out to the people who may be stigmatized by this. They need to know that they're not alone. So basically what we've covered today, how do I find out if I can reopen my business? You go to the New York Forward Lookup tool. How do I know what to focus on with my people, my processes, and my places? You go to the New York Forward Safety Plan. How do I know what behavior is good and what behavior is not good? You go to the Hygiene, Etiquette, and Practice. What if I need a lookup tool to measure what's going on with fatigue with my people? You go to the Epworth Sleepiness Scale. What are steps for safe and effective disinfectant use? Go to the EPA website. And so these last two are more resources for you. A Q&A webinar on the laws about governing employee matters. You're going to want to really bookmark this one. This is the EEOC Pandemic Preparedness. And what is my reopening checklist? Right here with the CDC Resuming Toolkit. So as we've said many times before today, in this training today, there's a lot of resources here. Where are you focused right now? What resource do you need to go to right away? So this module covered the following topics. The goal was to increase your awareness and provide resources for you. How does the virus spread? How do we control the virus? How do we plan, prepare, and respond to reopening? How to find out when we can reopen, and what's our safety plan to do that? How do we protect our employees? How do we protect ourselves? How do we protect our customers, right? And then being mindful of human fatigue and stress and stigma. Those are the key takeaways from this module. There's a lot in here, I know. And take a look at all that we covered today. It's like a miracle. We did so much today. Now, remember, if you're watching this on the replay, you can always press pause. You can always rewind. You can always go back. You can always download and bookmark and take notes. But don't assume that because you've been through this once that you know everything. You've done a lot of work today to show up for yourself. There's even more resources for you here. There's tons and tons of resources. And I want to say congratulations on completing Module 1, but I also want to say these women, these wise women, these business counselors, they're the ones who can take you even further to help you be successful. They are here to help, and this is free of charge for you. So meet Barb Stone, she's on the left. Sarisa Richardson is in the middle, and then there's Lacey Roy Ciccirillo on the end. And these are the counselors who can help you. These are the faces of the women who you can reach out to. You'll see here that the wisecenter@syr.edu email address is right there available for you. And you'll also see that you can call 315-443-8634. WISE is really here to be your partner, especially right now. So reaching out for help is the best thing that you can do to help yourself and your employees navigate this whole pandemic with much more ease. Thank you for staying until the end. My name is Jen Liddy, and if you have any questions, you can reach out to us, and we are here to help. Thank you again. Okay, let's see if there are any questions. Okay, Megan, did you have anything you wanted to say? At the end, there's no questions, so nothing I need to address. Is there anything you want to say to wrap up?
Absolutely. Well, fantastic. So thank you so much, Jen. Absolutely. Awesome information that you shared. And it was a lot, right? So there's so many good resources that are out there. As Jed mentioned, if you have any questions, don't hesitate to reach out. I know many of you are probably watching a recording of this because you're not with us here live today. So you can reach us at ycenter@syr.edu. I also want to let you know that we are holding our next live webinar on June 25th. So that's next week for all that are watching it this week. So that's going to be the management and practice of remote work. For those that want to watch this module via Spanish, that's actually being held on Monday, and it's going to be at 5 p.m. So remember that email address, ycenter@syr.edu. That's how we can connect you with the information. You can also go to ycenter.org and get to the same information. Everything's going to be available for you via our Eventbrite page. So thank you again. Really appreciate that great instruction, Jen. So.
Well, I want to say an appreciation to the people who did the research, and to Manal LTG who put it all together. So I just came and taught it, but I thank you to all of the people on the team who have been doing the research so that we could have really good, high quality content.
Yep, absolutely. And I think that you can, for those that are watching, you'll actually see LTG Consulting. You'll see the logo right there, doing a fantastic job and all this great work. So, all right, take care, everyone.
Thanks, everyone.